Hello, my name is Dr. Ken Rosenfield. I'm the section head for vascular medicine and intervention at Mass General Hospital. And I'm here today with Dr. Douglas Drachman, who is the fellowship program director for cardiology at Mass General Hospital. He's also an assistant professor of medicine at Harvard. And he is an emerging leader in our field, just participated in the ELM Emerging Leadership Mentorship Program, and is an interventional cardiologist who's one of my faculty in vascular medicine and intervention. So, welcome, Doug.
Thank you very much, Ken.
I wanted to ask you about a bunch of things. First is, in your role as the director of the cardiology fellowship, what do you think is the future for vascular medicine? Are there more people interested in vascular disease in general that are applying for cardiology fellowships, or is that something that is a bright future for people see as a bright part of their future, or not?
Yeah, thanks, Ken. Thanks for the question and for the privilege to be here. I think certainly that the interest in vascular medicine continues to grow among our trainees. I think first and foremost, folks really are aware of the fact that peripheral vascular disease is a scourge in today's society, afflicting nearly 8 million Americans, and that as we grow to recognize the emerging opportunities to treat these patients, not only recognize them, but treat them with advanced therapies, I think that our fellows and our training programs have grown really to appreciate the role of the vascular medicine specialist. Overall, there is tremendous interest not only among the interventionalists, but among vascular medicine specialists in general.
So talk to me a little bit about training in general. How is training changing and evolving? I know you've been very involved with the American College of Cardiology and the SCA&I, dealing with their training issues over time. And it's changing much more towards a digital modality. So talk a little bit about how you see training evolving over the next few years.
Well, I think there are many emerging opportunities in education in general. I think first and foremost, we're evolving to teach to the competencies and to understand what are learning gaps in individuals who are interested in learning in a particular field. So first and foremost, I think we're very focused on identifying a needs assessment for training, and then to identify specific ways to meet those needs. I think that there are different modalities that we use to address this. First, there are live conferences such as VIVA, which will always, I think, hold a preeminent role in education of trainees moving forward. Then there are also opportunities for asynchronous learning, such as online sources and through article review and journal clubs that are increasingly being held online. What I think is interesting about some of these evolving opportunities for education is perhaps the opportunity to track which individuals participate in which activities and when they've established proficiency or competency in a specific learning activity. So I think that as education continues to evolve, we're looking more and more to opportunities to identify how people will not only learn the information but incorporate that into their practice, and to be able to track this and measure this outcome.
So it sounds like we need to be a lot more scientific about the way we approach education, much like we approach all of the other scientific things that we do, just like almost like a research project that we might do, or a scientific question we might ask. We need to approach education in the same fashion.
I think that's a really fair assessment, but also it provides a lot of opportunities for us not only to understand first that we're providing the education, but that it's actually being synthesized or integrated into the practice of those who are learning.
So you said something a little bit about VIVA, and that you thought that there will be a role for these kinds of meetings. I know that across the country there are many meetings that are sort of challenged in terms of attendance, and we have fortunately been blessed with increasing attendance year in, year out. And I don't know that we know the secret sauce that makes that happen, but maybe it is because we bring more scientific and more, we're addressing specific needs that our attendees seem to ask for, or there are gaps in their knowledge. What do you think about that?
Yeah, I think that's absolutely the case. I think that in VIVA, it brings together so many specialists from different disciplines in a way that is very collaborative and provides really, I think, a 360-degree perspective on a given patient scenario, or on a given educational opportunity, or on a given scientific premise. And so I think that this provides an ideal platform for people who are early learners or experienced and very proficient operators in the same breath, I think, to share the same space, to exchange ideas and to have the opportunity to learn from the masters really in under one roof. So I think that provides a really unique opportunity.
Interesting. So as a program fellowship director or fellowship program director, how do you see the interdisciplinary aspects of this working out? I mean, across the board, we're seeing more of a push towards interdisciplinary collaboration. I think about your wife, Erica, who actually is a cancer specialist, and in the area of cancer treatment, there's a long tradition of specialties working together to bring the best thing for the patient. Do you see that happening more in vascular disease management? And how is that going to work? Does that have the potential to bring more value to the patients? What's in it for the patient?
Yeah, I think that's a terrific question. I think that ultimately this gets to the basis of care redesign, and I think that we're very, very invested in this in our own institution, as you're well aware. But I think that really the opportunity to join forces really with individuals from multiple different disciplines provides unique perspective on a given patient care. I think that while on the one hand, when there are institutions that are very siloed, there could be the opportunity for redundancy of activity. Someone sees a vascular medicine specialist, sees a surgeon, might see an interventional radiologist, and tests may be ordered in various different disciplines or interpreted in separate forums. When there is under one roof the opportunity to have a multidisciplinary approach to the patient, the exchange of ideas, seeing the same problem from different perspectives, I think there's really the opportunity for synthesis or harmony, I would say, in the ultimate objective and ultimately putting the patient first in a patient-centered approach. So I think this provides a really unique opportunity. I think ideally in this type of practice there would be limited numbers of times that a specific test is performed. There would be limited number of patient office visits to understand the perspective of different individuals who are all focused on the same patient's care. And ideally, maybe there would be opportunity even for shared perspective during, for example, interventional procedures, where there may be two different right perspectives on how to manage any one given circumstance, and the opportunity for people to recognize that two minds thinking about a complex problem can provide unique insight that may be stronger than each of the individual perspectives.
And I think that's an excellent point. And the only question is, how do we sort of get there? How do you counsel your trainees about that? When they see, this sort of evolving trends that they're not sure how to jump on the bandwagon. I think it's a little bit challenging for some of them, and even for some of us, to figure that dance out a little bit. But yeah. I mean, are we going to be training, is there going to be less siloing? Are we going to be training a vascular specialist that may flow from surgery to non-invasive to, and everybody has their own sort of Venn diagram that's overlapping? Is that where we're heading?
I think that's an excellent question. I think as we see in our current society, training programs are evolving pretty dramatically and very rapidly. In vascular surgery, for example, there may be individuals who matriculate to a program not as a general surgeon who will subsequently specialize in vascular surgery, but maybe to a shortened training period to specialize in vascular surgery. And that's, I think, among the pioneering efforts that are happening at Mass General with our colleagues. I think similarly, the opportunity for us to embrace trainees from different backgrounds, as we see at our own institution, as we share experiences with vascular surgical fellows, with interventional radiology fellows within our own vascular medicine program, adds opportunity to share the perspective from their various disciplines. And I do agree that there may ultimately be a hybrid training opportunities where someone isn't necessarily a specialist in surgery who does endovascular procedures or in medicine with endovascular procedures, but perhaps someone who specializes in vascular care of the patient and has various subdisciplines of focus as they proceed through such a training opportunity.
So you might see somebody with a surgical background, some with a medical background actually standing side by side, working together, even at the procedure table, trying to optimize the care for that individual patient.
I think in some respects we're seeing it already, but I think as we approach the future, this represents really a ripe opportunity for us to share perspectives with our colleagues in vascular care.
Yeah, and one of the ways to maybe get to that point is to be economically integrated, and maybe with the new models of care, ACOs and bundled payments and so on and so forth, that might actually enable us to get to that point. So let me talk a little bit about the economics for a second. do you think that we can continue to offer the kinds of intensive and expensive therapies for our patients that we're doing right now, and how do we get that right in the future? Clearly there's a limited resources in the system right now, and we're all feeling the constraints in that regard. What does the future hold for us in terms of that? I mean, are we going to be able to work that out, and how?
Yeah, I think that we're all going to be held accountable for the care that we administer. Clearly, I think that there are many opportunities that we have, first to demonstrate that our therapy is effective and ultimately cost effective. So perhaps, as you described, there may be a more effective therapy which, if administered once, save the cost of repeat procedures. That might be an optimal strategy for our patients, and certainly would be one that I'm sure they would prefer as well. But I think that the ability for us to demonstrate and to look forward to these types of challenges scientifically really represents an opportunity for us to demonstrate and perhaps to lead in establishing what is appropriate use for our therapies, what is cost-effective practice, and ultimately to identify what represents a win-win situation for our patients, for our economy, for the providers in general.
That's great. So let me finish up with one thing. By the way, in terms of leading, I just want to say that I think you're at the apex of that, and I'm really excited about the future because of people like you being involved in this field. So let me ask you one last question about it's about work-life balance. I think that when I look at you, I admire you because I think you've sort of got it right, although I know you're challenged by it, and we talk about that all the time, you and I, about the challenge of balancing your family life and your home responsibilities and the tough things at work, the demands that seem to be incessant. So what do you think about that, and how do you counsel your trainees about that, and how to maintain that balance in the future?
Yeah, I think that's an incredibly challenging question to answer. I would say that when I speak with our trainees about this, I think we're all the product of a career trajectory in which we're used to pouring 100% of our effort into a task. We're very task-driven, and what we find to be the reward is that we know we left it all in the field. As soon as you have two projects simultaneously, you can no longer be able to administer 100% of effort to either one of them, and ultimately that represents compromise. I think that as we mature in our careers, we have to find out what blend of compromise we can do. Maybe it's directing 100% of your effort into one silo for a brief period of time, then directing 100% in another, or maybe you're comfortable to split it 50-50. I think in truth and in practice, we all are perhaps offering 60% effort in two different fields at one time, and we feel like we're doing 120%. But I think that no matter how you slice it, if you feel as though you've done your best and you've tried your hardest at a given task, then you feel perhaps that's been the most rewarding opportunity. I think that there's no substitute for invested time in family. I think especially early in one's career, as we have children, and we're excited for all of those milestones of their development as they grow up, and I think that can be incredibly rewarding. But I think that almost invariably happens at a time when, in early to mid-career, when one achieves certain successes, there is the so-called holding on to the tail of the rocket ship as one's career accelerates. So I think that, in summary, that we all have to find an appropriate balance where we feel like we're able to commit ourselves to those things that are dearest to us and derive the greatest sense of satisfaction, but invariably how best to minister to the compromise is something that we ultimately tailor to ourselves.
Well, thank you very much. It's great to hear your perspectives, Doug. I do think that you represent the future of our specialty and of how to approach patients, and I greatly admire you for all the work you've done, and I really look forward to seeing your career trajectory go even higher than it already is. So thank you for sharing your perspectives today.
Thanks, Ken. It's really a kind invitation, and as you know, I look to you very much as my mentor and my role model, so I appreciate the opportunity to share the wisdom that you've shared.